joining us again on our podcast, Chronically. What is the name of our podcast, Alie? Chronically Real and Clinically Relevant. That's the name. All right. So today we are discussing a topic near and dear to my heart as a patient, medical invalidation, um, and its strategies both for us as medical professionals who are supporting patients going through this, and strategies from our perspective as patients ourselves. We are joined by Jessie Birnbaum and Sandy Robinson. Thanks so much for joining us. Tell us about yourselves.
Thanks for having us. My name's Jessie. I currently live in the Boston area. I'm finishing up my degree in the Master's of Social Work. I feel like I have a degree in medical invalidation as well, but that one wasn't as desired. I am going to be an OCD therapist, largely based on my own experience of living with OCD and getting treatment. Another population I'm hoping to focus on within like OCD treatment and anxiety is also those with chronic illness. I'll probably get into it a little more throughout the podcast, but I've kind of had a very long experience with the medical system of going from undiagnosed to misdiagnosed to somewhat diagnosed. I don't even really know where I land today, but have
Yeah.
had a lot of experience and I'm just excited to talk about it.
Thanks, Jessie. Sandy?
Yeah, thanks for having me. So,
Yay.
I live in Ontario, Canada, and I'm just finishing up a master's in library and information science. I hope to be a librarian and a researcher when I graduate in this summer. And I've had chronic illness and disability my whole life because I was born very prematurely. And as a result, I became disabled with cerebral palsy and a pretty severe bowel condition that still tries to kill me every now and then. Yeah.
Also a preemie baby over here, 28 weeker.
Oh,
Woo!
What was your gestation?
26 weeks and 4 days.
Oh, right on.
wow.
That's a great opening question. What's your gestation?
Yeah, you
Okay,
should do it
go
for
ahead.
every guest on the podcast.
All right, sorry. Go ahead, Sandy. I interrupted you. Anything else you wanted to add?
Yeah, no, that's okay. And I know Jessie because together and alongside our friends Mary and Jake, we run the Chronic Illness and Disability Special Interest Group through the International OCD Foundation.
And it's funny because I think that there's a perception that as a physician, myself, I may be less vulnerable to medical invalidation. Um, Sadly, that has not been my experience. And I think like, holy crap, what do people who like do not have a medical degree do to even survive this system?
Yeah.
Right? The struggle is so hard. Um, I remember I have several chronic illnesses. Some of them have a diagnosis. Some of them, who knows what's going on. Um, I remember, I think I did a lot of gaslighting of myself, honestly. Like, I had I had an episode that ongoing neuropathy, and eventually, like 2 or 3 years down the road, I was diagnosed as celiac, but it's still kind of unclear what causes small fiber polyneuropathy. And I was continuously like, I must have a psychosomatic illness because we can't find anything on the lab findings. Let me just like decide to stop having psychosomatic illness, right? And it'll go away. Alas, I as a psychiatrist, remember attending an appointment with a neurologist, and he continued to just ask my husband questions and just talk to him instead of talking to me. Um, and I'm like, I have a, I mean, it's the American Board of Psychiatry and Neurology actually that we get qualified in as psychiatrists, but obviously I'm not the person to talk to, right? As the female in the room. So, uh, the populations who tend to be most vulnerable to healthcare invalidation. We saw in this research study, what year is this study? It was a 2023 study on medical invalidation. So young populations who people don't expect to have an illness, people who it's invisible, you can't see anything on the surface that's wrong with them, illnesses that aren't well known yet, gender, females, or non-binary, or ethnic minorities are much more vulnerable to healthcare invalidation. And if you have any concurrent psychiatric diagnosis, like anxiety, much more vulnerable. My husband, he says to me, he has an anxiety disorder and some OCD, and he says, I definitely make sure never to tell any doctor that I have anxiety so that they won't assume that all of my symptoms are my anxiety. And I'm like, yeah.
We have conversations like that all the time in our group because everyone has OCD and chronic illness. And they're always like,
Mhm.
well, like some people will say,
Right.
I can't get rid of my OCD diagnosis on the chart. Like, what do I do? They always say it's OCD. And some people are like, I like that they have that. And like, so they know more about my
I mean,
background.
you think it would be great for them to have the full picture.
Yeah, but it usually ends up kind of biting them in the butt.
I think like I know a big reason why me and Stacy, or why I'm interested in this topic and why I'm talking about is I have a similar experience of navigating chronic illness also since I was basically born. I was
What
diagnosed.
was your gestation?
Yeah, was your gestation, Alie?
I was on time, or I wasn't a preemie.
Right. So 38 to 40 weeks then.
Correct. I don't have the exact day and time because I was deep diving into my horoscope, but that is not clinically relevant. But thank you to my mother for documenting that. I'm a Sagittarius, 1:48 a.m. But I was 3 years old when I was diagnosed with juvenile rheumatoid arthritis, and how we came about this diagnosis, or how they did. I wasn't too involved. Was that basically my sister was like pulling at my hair, and clumps of hair were falling out. And even when I was a toddler, I was saying to my mom, like, I need to go to the hospital because I was in so much pain in my joints. And sure enough, had an autoimmune disorder that I had to navigate since I was a toddler and all through my adolescence, and at the same time navigating undiagnosed OCD. And especially when school refusal was picking up for me, which was a lifestyle that I engaged in a lot.
Really?
I like to say that like I was avoiding school or school refusal before COVID made it cool. Not that it made it cool, it just made it a little more common, I feel like. But the complicated intersection of like having mental health challenges that result in avoidance behaviors, but then at the same, and also seeking medical advice, but at the same time also having an actual, like, not, I say actual, and I think that's exactly the problem, right?
Oh, right.
Totally.
Condition and a mental illness at the same time. And it's a complicated experience, as many people will attest to, including, I mean, that's why you all have, I'm sure, a huge reason why that special interest group exists, right?
Exactly.
Yeah, you're always like, is this real? Is it?
Well, I have a really similar story too, where well, very different story growing up, but then similar in the sense of like, I was very healthy growing up. I played all the sports. I wasn't very good, but I played all the sports. I did everything, and then got really sick when I was around age 20, which is apparently really common in females. I've heard that that's kind of like the age, but started getting really sick. And then I was convinced like I had to go to these doctors. And I told my mom, and my mom's at all these doctors. We went from doctor to doctor to doctor. everyone's saying you're fine, there's nothing like in the red like on these on the tests. And then I totally convinced myself it was OCD. Like if all these doctors are saying it's nothing, like then it has to be me. Like I'm doing it for drama. I'm doing it like, which I would never do, but OCD will convince you of the craziest things. And then I got a colonoscopy and they diagnosed me with Crohn's. And I was so happy. I was like thrilled to finally have an answer, which was like later taken away from me. But I was so happy that like a lot of people in our group will be like, yes, I got results. Like I got something negative came
Right, they're
back,
like,
and
yeah, my
we could
test
show
was
the
was
doctor.
bad.
Yeah, we could go and be like, hello, look, like I wasn't faking it. And for me, so much of like getting results is like reassuring myself that like, no, it's not OCD. Like it's something very real that my OCD latches onto.
Yeah.
I think
What
for
are your thoughts,
me,
Sandy? Yeah.
oh yeah. My story is almost a little bit opposite to Jessie's. So as I said, like I was born disabled and chronically ill. And I think I've had OCD since I was a toddler because I can remember back to like around age 3 symptoms starting. But my anxiety and depression and especially my OCD wasn't diagnosed, and well, my anxiety and depression were diagnosed, when I was a teenager, late teenager kind of thing. But then my OCD wasn't diagnosed till I was almost 25. So it was a
Wow.
long journey to get there.
Yeah.
Yeah. And it was bizarre in some ways because so much of like the treatment for disability, I feel like for children, is you learn like physiotherapy exercises and you do occupational therapy and you do life skills and you miss school, but you make up the time and you make up the work. But I didn't learn anything about like how having a disability or a chronic illness could affect your mental health,
Yeah.
and how there's often a relationship between chronic illness and disability and mental health. And I think that's a huge missing piece.
Yeah. I can also, as someone that's also like was thrown into the medical system before, I mean, that's my whole conscious life, right? I don't know if this aligns with your experience too, Sandy, that like growing up with all those and constant specialist appointments and living in and out of the hospital. Um, you also, at least my family, developed a mentality that paired so nicely with my OCD when I eventually was also diagnosed at 25 of like, if there's a problem, if there's an issue, we will find a solution, right? We will find the provider, we'll find the specialist, we'll figure it out.
So your family was really proactive. Yeah.
Yeah, I mean, I think when you have chronic illness, and this like are medically complex, it's a lifestyle. Like, and that's where like it's also as a family, it's like I mean, my mom was there with me, right? Back to back appointments, driving to Denver. And it instilled in me this kind of like belief that is a double-edged sword with OCD of like, if there is something that I'm struggling with, we will figure it out, right? We will find the provider that will listen to us and blah, blah, blah. And that is a great strength until OCD for me took that of like, I will find an answer. I will find the treatments that will make this better, and then twists it and uses it against me to take over my life, right? And that's where I think navigating the healthcare system, being chronically ill, and I think with medical invalidation, the word that you hear over and over and over again that I also pride myself on is like being a good self-advocate. And when does that turn into being OCD's advocate? Being, and I think that is such
And distinguishing the two. Are you advocating for yourself, or is OCD taking over your voice?
Are you advocating for OCD? And that
OCD.
that can, and I think that's the whole thing.
And
that we don't know.
I mean, I also think that the instinct of a lot of medical professionals when they are sitting with someone with a lot of fear and someone who's having a hard time dealing with uncertainty is to automatically say, you're good, you're fine, right? So I think the instinct for you're great, you're so healthy, um, comes from a well-meaning place that has never ever actually worked to reassure anyone.
That used to make me feel
Ever.
horrible when people are
Right.
like, because I look very healthy. Like, it's invisible.
Right.
As you said, it's an invisible illness. I'm young, I'm female, I have all the things, right? And so they used to always say, like, oh my God, you're so healthy. And I'm like, I'm here because I'm like passed out. Like, how is that healthy? Like, but
I
they'll
mean,
try to reassure me and be like, oh, you're so healthy. And that would kill my OCD. I'd be like, oh my God, no.
and because you would think this doctor, nurse, whoever it is, really doesn't get it and really isn't seeing or hearing me right now. Even like I would say as a medical professional, so much more powerful to just acknowledge and be with someone in the fear of uncertainty. Like, this is really sucks that we can't figure out whether this is A, your OCD, B, an autoimmune disorder, C, something else right now. That is really rough that we haven't been able to figure that out yet. That's really scary. Just being with people with those feels.
Well, and I think that takes a certain level of humility that also our medical system is not designed for either. The medical system is designed for like, there's a problem, what can we do to fix it? And so I think that could be very um, either threatening or just very discouraging for providers. And then to tell a patient who is like has OCD that is seeking desperately certainty to tell them we don't have an answer or we're not sure is quite a terrible combo, right? Where we're like, we want an answer, we want it now. And did you think about X, Y, and Z, right? And I think that, I mean, the things that have been said to me by providers, looking back, I'm like, wow, in what world did you think that was either okay or helpful to say, right? And I think that's where now, in looking back, I'm like, that comes from their own insecurity. But in the moment, and I think that power differential piece is huge, that it was crushing to me, right? It made me feel so small and broken, and even more so like crazy, right? Like I am making this all up, I'm crazy, right? And I think knowing like the fear or even the actual experience of being labeled as attention seeking or diagnosis seeking or whatever it may be was just
A
like pouring
professional patient.
or yes, right? Was just like gasoline on the fire. I'm curious about for you all,
Yeah.
Jesse and Sandy, if you have experiences like that that you look back on and you're like, wow, that was
Yeah,
what happened.
Alfie, for sure. I think when you speak about that power differential, that is so huge. I know growing up sort of in the medical system, in and out of hospital, I really felt like, well, the doctors and the nurses and the medical professionals, they know what they're doing. They are in charge, and I'm just like following along the good little patient. And it's so interesting because, even when needs weren't necessarily met by the medical system, I would want to try to overcompensate. And in the end, I would try to be the best patient, the best student, the best athlete, friend, whatever. And all those things, while they may have gotten me a few accomplishments, they didn't actually fix my disability or my chronic illness, or in fact my OCD. So it is interesting how there's so many unwritten rules about power and the way we have to interact with power. And of course, there's
Definitely.
lots of wonderful doctors and nurses.
Yeah. Yeah.
There's
I think we should take a minute too. I think if we could like highlight some of the best possible things that medical professionals has said or done that have helped you in your journey and kind of like just take a minute to highlight that. Yeah, like what would you say, Sandy, if we just highlighted that?
Yeah, I think just
And so we're not all to doom.
I think just holding space for me and saying, this is really tough and I don't know the answer, but we're going to look into this and we're going to figure out what's going on. It may take some time, but we're here for you and we're here in this journey with you.
So much more reassuring than like pretending, oh, you're fine. Yeah. What about you, Jessie? What have been the most powerfully helpful
Yeah, I
things
so
medical
agree with what
professionals have done? Yeah.
I agree with what you guys said because there's one doctor who stood out throughout the entire experience. Like,
Yeah.
love this man. Like, will name my firstborn after him very likely. Like, love him. And he that has been with me through this whole period, and he has like he doesn't know what's going on. Like he genuinely has said to me, like we've had conversations where he's been like, yeah, like I don't know. Like this is really complicated. And he said before, like, they're going to open up a textbook and it'll say Jessie Birnbaum disease. Like it's something that is very complicated. And I was like, yes, they think it's complicated. Like they get it. They know I'm complicated. They know it's real. The biggest thing he said, one is like, I believe you. Like he's been very like stern throughout the whole process of like, I believe like this is really happening.
Yeah.
And two, the biggest thing is I like my mom and I were like crying when he said to me, like, I don't know, but I want to help you. Like, I
Yeah.
love when they say I don't know because they don't know. Like a lot of the times,
But also that they
don't.
are
Like,
committed to like helping any way they can. It's so
yeah,
much more powerful than to say that they're sure, right?
right. Because they're
And
not sure. If they
no,
were
I
sure,
mean,
they'd
I'm
give us
not,
an answer.
human beings are complicated. I'll tell you guys, in medical training, part of the process of medical training is you're constantly kind of living in fear of getting kicked out of medical training and the weeding out process. And what gets you kicked out of the tribe of medicine is not knowing things, not knowing enough of the things. And you'll be rounding on patients and publicly shamed for not knowing the answer to random questions they ask you during rounds as you present your patient. And so I really feel like that contributes to pumping out medical professionals who it's hard for them to sit with the pain of not knowing how to help someone, not knowing what's going on, and feeling like crappy because we don't have something very specific and concrete to offer to alleviate the person's suffering who's sitting in front of us. And it's so powerful to be able to actually embrace that as part of a healthy relationship with your patient, that there's going to be suffering that you don't fully understand and aren't able to fully relieve someone from.
Yeah, and I think there's this liability aspect that I come into
Well, yeah, that too.
all the time, especially with people who have had a similar presentation of me that I call the trifecta of health OCD, health anxiety, and panic disorder, which I can promise you, if you call your primary care office right now and say, I'm having chest pain, should I go to the ER? The answer will be yes, because
Right.
over the phone, as an OCD therapist that also has made that call with lived experience many times, I think that's where I don't blame them or any of the medical systems for doing that, and that's where we have to be thoughtful as
Defensive medicine. Yep.
we have to be thoughtful about what the systems are set up, how they are also set up to safeguard against liability and risk, while navigating a disorder that's all about leaning into risk and uncertainty, right? And that's where if, you know, I, with most of the providers I work with closely, I'm like, I have OCD and I'm telling you this for this reason, so that you're like, if there's, a spectrum of choices that they're trying to decide of what to offer me, and one is like on the very cautious side,
Yes.
the other is like more on the, well, this is what I would
Which one will Alie pick?
Recently, I had an episode after I had neurosurgery a year ago, and so after that, we've been on the lookout for strokes or aneurysm ruptures ever since. And I had an episode a couple of weeks ago that ended up being a migraine, but I went into the ER post ERP, thank God. And they did all the things. The doctor comes in, he's like, "Well, we could do a spinal tap." Or whatever, and do
Right.
this to rule it out. And my response, as having done the work, I was like, "But what would you recommend to the most people?" Right? He's like, "Well, that's very obscure." I was like, "Yeah, I'll pass on the lumbar puncture."
Oh, sure.
I think he's like, "Yeah," and so I think that's where that's a very different experience than you going in, which I had done many times, begging for more tests and begging, And
Good
then,
for you, Alie.
but yeah, that's the work of also living with
It's
OCD.
it's a lot. Hard won. Hard won.
Tough sell, but
For sure. Yeah. And this 2023 qualitative study, it was medical invalidation in the clinical encounter, a qualitative study of the health experiences of young women and non-binary people living with chronic illness. I think it was really notable. When people think, oh, medical invalidation sucks, that's people get their feelings hurt, and that sucks. That's a poor bedside manner. That they're missing all of these aspects of how it really impacts healthcare outcomes. So this study showed that the people experiencing medical invalidation um, led to a lot more medical avoidance. So they weren't following through on appointments. They were avoiding going to the doctor. They experienced a lot of emotional and psychological harm. And so they had worse physical health, left appointments feeling guilty, like a burden, tried to go do research on the internet themselves to try to figure out what was going on because they felt like they were all by themselves and alone in trying to get their healthcare needs met, or just didn't disclose, right? I mean, that's a great question. Like when I go to the doctor, we talk about this all the time. When I go to a new doctor, should I tell them I'm autistic? Maybe it's helpful because there's a lot of chronic illnesses I have associated with autism. My dysautonomia, my hypermobility, blah, blah, blah. It goes on. But at the same time, if I tell them I'm autistic, are they going to be like, you're an idiot. You have no idea what you're talking about. I don't know. I don't think there's really a clear answer, honestly, of how much to disclose one's psychiatric history in these appointments. It makes me so sad.
I don't think there's a clear answer
psychiatrist.
either, and I think it depends on the doctor. Like I know my therapist has actually had conversations with the doctor I mentioned because like to fill him in on OCD and stuff like that, which I've found to be really helpful. Would I do that with like another doctor? Like
Right.
I could think of like all the other doctors I have and it would be like a no for all of them.
No, you think it would be more harmful than helpful to tell them.
100%. I
Yeah.
think it really depends on the person, but I run a chronic illness group of people who have more so like rare diseases or ones that are like hard to diagnose, and every person in the group has said that they like just what you said, like they feel guilty after appointments. Someone said today in the group that they were gonna reverse gaslight themselves into thinking the ER might be helpful because they've had such bad experiences at the ER. And
Oh,
it's just
man.
like endless, these different stories that you hear. It's really sad.
I mean, I've had doctors tell me you should take fibromyalgia off your chart so that people will like not take you so that people won't not take you seriously. No, that's actually my medical diagnosis. uh,
are
yeah.
there like as far as with your lived experiences navigating medical invalidation and kind of the outcomes or how it's changed, how you navigate the medical system or mental health system or just in general, are there other things that come to mind?
I mean, I would say personally with what you were saying, Stacy, like
Yeah.
it's not just that invalidation is like, oh, like that sucks. Like, and I think if you don't go through it, it's hard to almost understand how like crushing it is because like
And like
even I'll come
helpless
home.
feeling, right? Like you're so
Yeah.
vulnerable as a patient.
Yeah, and you're so desperate. Like I've been to appointments where I went I was living in North Carolina and I waited probably like 6 months for an appointment with this like very specialty like allergist. I drove 2.5 hours and she was like, "Have you tried Zyrtec?" And I was like, Yeah. And then she's like, "Try it again." And then like sent me home. And I was like, "Oh my God." And then I call my dad, who hasn't experienced any of this. And he was like, "Oh, that's annoying." And I was like, "No, it's not annoying. It's soul crushingly painful. Like, it's horrible. Like, the
Yeah.
ups and downs. Like, you get so much hope.
Yes.
And then it's like crushing. And
I
so
know, and you wait so long for an appointment.
exactly.
It's tough. You know,
Yeah, that it's
I
not just
remember my doctors, I was like, yeah, ADHD treatment. Oh, have you tried exercising for your ADHD?
Well, and I
I get
think
that all the time.
I mean, and I think when it comes to wait times, in the States, that's one thing. But Canada, that is a whole other beast when it comes to wait times. I mean, I've had so many family members that, it's like, oh yeah, you need to have this surgery in 2 years. And they're like, well, is there any way to expedite it? Yeah, go to the States. And I think that's a challenge that I'm curious about for you, Sandy, navigating especially those specialty providers, and like knowing that sometimes you have this one shot for such a long period of time, what that's been like for you.
Yeah, no, you're right, Allie. There definitely is some long wait times. And I think from what I hear, like there's not as much choice as specialists. Like you can't just pick a specialist because they seem like they're more experienced or something. For instance, I had this one specialist that I was on a wait list for 7 years for surgery that I really, really needed. And then COVID happened and I was still on the wait list, and I ended up having to switch surgeons, but I had to go to a whole different geographic area just to do that. So it was a challenge for sure. Um, but I think like overall, I'm so thankful for the system that I have here, because it's a little bizarre because most physical medical stuff, so most of my chronic illness stuff is covered by the government, but then of course mental health is not really covered. So I'm
Of
still
course.
sort of like looking around for ERP therapists and specialized therapists who know what they're doing with these conditions and not actually making it worse. So that's always a challenge as well.
For
Yeah.
our listeners who aren't familiar, by the way, ERP stands for Exposure and Response Prevention, which is an awesome strategy and therapy for anxiety and OCD, among other things.
Yeah. Yeah, I've been deep diving. I'm Canadian as well. Also was born in Ontario, and that's where most of my family is from. And recently did training up in Toronto, where I was meeting all these Canadian therapists, and I was like, I've been waiting my whole life for this opportunity, and learning about exactly that, of like the challenges specifically with mental health in Canada, and like when it comes to universal healthcare, what does that mean? How far does that extend? And all those things. And I think that's something that, when I think about navigating chronic illness, complex medical situations in the States, that is the added layer of like not only all of these things that you're managing, but also the financial side too, right? Of like every time I went to the ER compulsively and I was going for a week,
Yeah.
that's a new bill.
Yeah.
That's a new thing that was adding up, aside from like also my frustration with the system, aside from my OCD. Financially, it was like, I mean, these are catastrophic situations that, like financially speaking, that families and individuals have to deal with on top of all these things too, that I'm grateful the Canadian system doesn't have that extra layer, even though you have to navigate these other pieces. But I think that's something that I have a lot of conversations with patients who are navigating OCD treatment, which is expensive a lot most of the times. And then also all of these medical bills that they also have, and navigating that financial piece in treatment
Yeah.
makes it even more complicated, right?
It's kind of like I think having a lot of chronic illness is like having a second job, except you lose all your money instead of make your money for your
So
second
true.
job.
But no one recognizes it as a real job. They think it's a fake job.
Mm.
But it's tough. It's emotionally, um, as well as financially draining.
Right.
And I'm always trying to encourage. I like coach my husband as he goes to his appointments too, right? Like one time he got in an argument with an ER doctor, and he brought out a white reference paper, and I was like, nope, it's all over for you now, man. You brought out a study. It's over for you now.
Allie,
um,
going with what you said, my biggest regret, and I think my family's biggest regret, has been that in the middle of all of my trying to figure stuff out, we found this doctor doctor online who lived like an hour and a half away from me and said like she went to like a very reputable medical school, said she was a holistic doctor. She I know. She said she like you pay her, she finds your answer. And as a someone with OCD, I was like, Mom, we have to do this. Like, and my mom's desperate, my family's desperate, I'm miserable. And so we paid a very large sum of money for this woman to diagnose me. And it took months and months and months, which we're still paying. And she told me I had Rocky Mountain spotted fever and that I was poisoned by toxic mold. And I believed it because I was like, oh my God, there's an answer. She believes me. I'm so desperate at this point. And I
Yeah.
think there's this like,
I mean, these are predators. These
yes,
like
she was
like,
preying on my
yes.
desperation and like this OCD urge to like as much as like my mom also wanted an answer, my dad wanted an answer, but I like needed an answer. And so we spent probably about a year seeing this doctor who didn't help me whatsoever, made things way worse, and we lost
Yeah.
a huge sum of money. And it's
Yeah.
painful to think about, but like that's why I talk about this, because like it's so easy to fall into these like traps of like I just want my kid to get better, or like
you know,
I
and
want
it's hard to
validation.
it's hard to judge the veracity of information.
Yeah.
There's we need a whole nother episode on medical quackery, Allie. We really do. I mean, there are a few things that like burn me up as much as like people preying on that. Like there is a huge franchise in my town that I won't name that takes children and they make them do all these little exercises, and then they tell the parents how the child is so messed up with all these primitive reflexes. The only way to save their poor little baby child is to pay for all of these wonderful supplements, of course, that are going to balance their brain.
Oh, I paid for a bunch of supplements
right?
too. Yep.
Just completely predatory.
Yeah, I've been there too. And I grew up in Boulder, Colorado, the home of snake oil, navigating complex chronic illness and all these things. And I also found I don't know, maybe TMI, what's new. And some woman who had me take a dump in a box and send it off and came back with
My
all
poop has gone to Belgium. So I'm right there with you, Allie.
how many where have you shipped your poop to? Should be another question that's on the
Yeah.
I know I've shipped my poop. I don't know where it went though. I did not pay
You
attention.
know what? Sometimes it's better. It's for the better not to know.
Right.
Sometimes you're just curious, though.
Right. And then according to my poop assessments, gave me a list of everything I can and can't eat. And next thing you know, I'm covered in acupuncture needles under a layer of tinfoil with some woman
Yeah.
who's going over all the supplements I'm going to be taking with my mother. And I'm in this back room covered in tinfoil going, huh?
I mean, and there's some data to support acupuncture for chronic pain, for example, right? And I think what's hard is like they'll take pieces of real medical science, but the like whole is quackery
And the
and
thing
predatory.
I'm always looking out for is the like golden ticket, like we can figure it out and fix it kind of verbiage. It's
Yeah,
like
yeah, that confidence
Now,
self.
when I see that, I know stay away.
if you poop in a box and
Exactly. It's like yes. Well, sometimes you have to give a poop sample, Allie. Okay,
I'm not
but
poop samples. I've done that for real legitimate reasons. Too
I
many
have the boxes
okay,
in
but like
the
okay,
empty
so like
boxes ready to go.
the medical professional you want to see is the one who will openly be like, this is confusing and complex and not clear cut.
Yes.
not that we will pay a ton of money up front to do all these things with the idea that like all these systems have failed you and we have the solution. And that's where I think I'm not, being also an ERP therapist, no C therapist that like has that has a spiel of like, and there's all these non-evidence-based treatments for OCD out there, but what we're doing is different. I think I have to be conscious about that. And I by no means do I ever claim that like we will solve your OCD. In fact, I say the opposite, which people hate. But
Right, and that's how you know you're a good OCD therapist.
right, is if you're like, no, I won't make you I won't get rid of your anxiety. You have to say that in a different way. I think that's where with medical, and especially when you've been through so much medical invalidation, to have someone say, I hear you and I will solve it, it's a perfect recipe for these predatory behaviors, right?
So let's talk about, okay, what healthcare professionals can do better. What are your thoughts, Sandy? What can healthcare professionals do better?
Before, I think just like the idea of accompaniment alongside the medical journey, like maybe, the patient you're seeing, it's like your third patient on a Tuesday, but for them or for me, like it's a really big stakes appointment that really matters to me. So it's just that
Yeah.
attitude of care, I think. And, of course, like medical experts are medical experts for a reason. They have schooling and they have degrees and they have training, and that's really important. And so is the lived experience of a patient because they're experts in their own body and their own mind.
And their own experience of life. I always tell my residents that I'm teaching and my PAs that I supervise, always be humble about your knowledge and aware of your power
Mhm.
at the same time. Yeah. And don't be burned. I think a lot of this is okay. This situation is really crappy for health people. So, barely having time to eat. He super scarce. It's a system of scarcity where there's constantly 3 times as much being asked of us, needed of us, demanded of us than we can humanly provide.
Mhm.
I mean, trying as much as we can to not be burned out, I think, is a first step towards being able to um, be emotionally present with our patient. Like now, and I'm all about not just humility, but curiosity, non-defensiveness.
Mhm.
Recognizing that patients have their expertise on what's going on with them. You're like co-experts teaming up. And I think we need a better healthcare training system that instead of cultivating competition, self-deprivation, which is how people get so cranky and burned out, and defensiveness, we're actually cultivating some self-compassion and self-care in our healthcare professionals. But I know that's a tall order.
And I think it's interesting because when I think about burnout and how the system is structured, and I think actually this problem is of like what I'll describe as in a way less nice way than what you just said of staying in your lane.
Yeah, staying in your
Because
lane.
when you don't stay in your lane, though there's a better way to put it, like
No,
focus
that's a good way to put it.
can and can't do, what you do and don't know, what you do and don't specialize in. I think that what is
Seriously.
where therapists are even more susceptible to this than medical providers, where it's a lot clearer of like, I specialize in X, Y, and Z. And I think that's where both medical providers and therapists get themselves in trouble is when they aren't honest and clear about what they can and can't do, what they can and can't treat. And I think that's where they'll get set up for burnout. And I think in some weird way, actually, some of the people that are more susceptible to that and therefore doing are the people that care so much. They're like, oh, we will figure it out. We will do it, blah, blah, blah. And they're not honest about
Without boundaries.
right.
Yeah.
And so that's always something that I'm pushing for, especially for therapists. I think that happens less because of specialties, but some of the things that have been said to me that have been so unhelpful have typically been by providers who are giving advice about a specialty that is not their own.
Oh
Right.
my gosh, all the time.
Seriously. Yeah, and do you
All
feel
the
like that's
time.
more common in, I feel like that's more common in mental health. Like as a psychiatrist, I see that. I would never give my patient advice about their cardiology meds, but I send my patient to the cardiologist to be like, hey, let's get some clearance to increase your stimulant medication. And, here's a litany to my patient about why they should not be on ADHD medicine.
Yeah.
Yeah, from the cardiologist. Yeah.
Right.
I often get accused of like when I'm at appointments, like, well, then why are you taking this? And I'm like, oh, because like the cardiologist said to take it, and they're like, I wouldn't recommend that, and I'm like, I don't know anything about these
Right.
medications. It was prescribed to me, and that's what they thought, and they're like, I don't know why you're doing this. Like, I really wouldn't do that. And then you start second guessing, and you're like, who should I
It's
trust?
true.
Who should I not? It gets really
Yeah.
confusing.
It is. I was like talking to Alie. I'm like, okay, so pregnant patient. It's like, should I not continue my fluoxetine? Right? Who do you listen to about that? Your
Mhm.
reproductive psychiatrist? Check. Right? Your pharmacist? Not so much. Right?
It's maybe on fine because I may or may not have called Stacy a couple weeks ago and been like, you would
Yeah.
not believe the ridiculous comment I just heard from one of my
From
doctors.
your neurologist.
I wasn't going to name names, but
Sorry. Sorry. I
Well-
never said that. Sorry.
that will bleep it like it's a swear word.
Yeah.
Well, if you want to be pregnant someday, you're going to have to get off of all of these. And thank God
Right.
I'm a provider that happens to have a best friend that's a psychiatrist. But like who isn't, who most people don't, and I'm like, yeah, okay, and let that one roll off of me. The average person would be absolutely
Yeah.
terrified to hear that, and I think that's
Yeah.
staying in your lane. What do you know? What don't you know? I'm like, sir, tell me about your background in perinatal psychiatry. Oh, nothing? Cool. But I think
Awesome. Right. Consider the source of the information.
anyways. But yeah, Jessie, what
Yeah.
about for you? What do you feel like would be the things that for medical professionals they should be doing more of, or be focused on with providing quality care that's validating or supportive?
I would say exactly what Sandy said and what you guys have added. The only thing I would add is that I don't know if you guys experience this too. Maybe it's just because my stuff is like there's a lot of different stuff, but I have to go through my medical history like every single appointment. And it's very complicated. And I've been told like there was one doctor who was like, your chart's too long. It's really bothering me because I have a ski trip and like I have to go and like this is really long and complicated. Why have you seen so many doctors? And then, yeah, but I feel like it can be really tough when I'll be asked, like, when was your colonoscopy? When were you diagnosed with this? What is the exact day? And like, who knows all of this stuff off the top of their heads? And then if you don't have it memorized, A, you seem like a bad patient, as Sandy was mentioning. B, you seem like you just like don't know what's going on in your own life and medical care. And it's very stressful on behalf of the patient. And I've been working on largely like looking at what Sandy's done, but like working on like a medical binder of like what are the dates of everything that I can bring in with me. But like of course that takes so much time, but it's so stressful to go over everything and also like kind of like traumatizing to go through all of this history of things. I often get accused. It's like, well, why did you think you had Crohn's? And I'm like, because they told me I had Crohn's. Like, why wouldn't I believe that? So I think there's a lot of like accusatory or like just going really quickly and being like, okay, well, when did you get this? And I'm like, I don't know the exact day. And then they're like, ugh. And so I think just kind of like the taking time to like slow down and really like recognize, as Sandy said, like for a lot of people, like this is a big deal. Like getting in to see a specialist can be a really big deal. So
Hard.
kind of honoring that.
I tell my patients all the time, your job as a patient is harder than my job as a doctor. It's hard.
Yeah, I think that's where they go, and I get it. I get it as like also a provider, and of like when you go over the same questions or the same things that you're looking for over and over again, you can get burnt out or get kind of in this autopilot. And I think that what my least favorite questions are the ones of, well, when did you start noticing this? How long have you? I'm like, oh, I don't know. I've been in pain since I emerged from the womb. 90
Since my gestation.
right. 40 weeks, give or take. And I have no recollection of like how long. I think that's like pairs nicely with my ADHD. And when that is therefore taken as like that it's not serious or that, that I'm not being a good patient, I think that's something that I've had to navigate, having health OCD also in my background, being okay with not being able to provide those answers, and like letting their like, roll off my back, and
Right. You have to get thick skin.
well, and I think also just like because I know I tend to veer on the side of the spectrum of like then overcompensating, of being like, I need to tell it all clearly,
Yeah,
precisely, and in this way to make sure I don't miss anything, because that's my OCD.
I know. You have to leave your pride and your perfectionism at the door when you go into your medical appointments.
And my medical scrapbook from high school that I made for fun, not function, which I was like, you guys have a binder? I have a scrapbook. Incredible.
That's cool. I want to see your scrapbook.
I love that there's a
sometime.
scrapbook.
When I come visit you, I'm going to see your scrapbook.
I will show you. Maybe I'll feature it as like one of the photos. But
Right.
I had
In
to
the
let
show
go of the
notes.
scrapbook. And be like, Allie, if you go to the ER, they don't want to see your scrapbook. Like you're either dying or you're not then. And even then you don't know for certain when you leave. Easier said than done, right? Trying to find that balance is so hard.
Yeah. What do we tell people struggling through medical invalidation? Do you have thoughts, Sandy?
Yeah, I mean, if you have OCD or some kind of mental health condition alongside your chronic illnesses, I think there's so much hope of mental health recovery, even in the midst of chronic illness, even in the midst of disability, because like things like exposure and response prevention are evidence-based, they're gold standard, and they can be adapted to accommodate chronic illness. And a good therapist will be able to walk with you and make those accommodations while not accommodating for your OCD.
Yeah. And your job is not to be liked by your doctor. Your job is to get your healthcare needs met, right?
That's always a hard one
You
for me
need,
to remember.
right. Yes. Your job is to get your healthcare needs met, not to be seen as the best patient, not to avoid any criticisms or judgments. But definitely don't get into power struggles. Don't get into power struggles.
Oh, and that's such a good point, Sandy, because I feel like one of the things I also faced in the midst of severe OCD and this stuff at the same time, and a lot of people, is that sometimes it feels like you have to figure out the medical first and then the mental health, or maybe there's providers also who will say the other way around, and that there really is the option, or like you can do both at the same time, and they're not opposites, they're not like conflicting, right? And I think that's where a lot of providers have questions, who are therapists or people that treat OCD, feeling like, well, should I, do I need to put healthcare medical seeking on hold? And my answer is always no. That's not talk about liability, right? How we can do these things. You just have to be
Yeah.
mindful and craftful about where is OCD going to sneak in, and anxiety, right? And try to twist things. But I think people sometimes feel like, and I know for me, for sure, it felt like doing OCD therapy, my fear was that that was saying that my medical conditions were invalid, right? And that's not true. But that was a tough pill for me to swallow, and be like, yeah, both are real, both are legitimate, and I can take on both at the same time. Maybe one more so than other at the time, right? But yeah.
No, it's so
I
hard.
think
It's like, yes, this patient does have a personality disorder, which there's so much stigma against. You get me talking about that for life. And they also have very real medical illness too, right? Like it's not like one X's out the other one. Sorry, I interrupted.
Oh, that's okay. I think for me, getting my OCD and anxiety and depression under control really helped me be a better advocate for my own like medical
Yeah.
chronic illness, because I was more able to sort of stay calm, keep going down the path, be patient, and do, what the doctors told me was evidence-based and the best treatment for my chronic illnesses.
Yeah. No,
That's
it's
awesome. Working with my therapist is awesome.
mhm. What about you, Jessie? What do you feel like would be the message you would want to send to people navigating these situations?
I would say that like there is such a community of people who are experiencing this, like, unfortunately, but I think it's way more common than people think, which is why Sandy and I started the special interest group, is because it's so common to have a
Yeah.
mental health condition and to have a chronic illness, and even negating the medical or mental health condition. Like, I think it's really hard to go through the medical system and not experience some form of anxiety. I think it's a very anxiety provoking experience, like, regardless of like how you come into it. So just kind of like validating that like that's real, and like appointments can be really scary even if you don't like have health anxiety. I think people think, "Oh, I'm not anxious, like I'm fine. It's a doctor's appointment." And then they come out and they're like, "Oh my God, like what just happened?" And it can be really stressful. And I think people, it's not necessarily the norm. Like, I think people are kind of used to, like, oh, if you come in with a specific thing, like a broken arm, you get a cast and then you get better. And for some people, like, that's just not our experience. And it's kind of
Yeah.
a longer process. And that's very real. And
It is common. I'll throw out some data here. Okay,
oh,
this
yeah,
is a
give us
this
the
is a
data.
sorry, this is a 2019 study. Dismissing chronic illness, a qualitative study of negative healthcare experiences. 77% of the people that they interviewed in this qualitative study had negative experiences in healthcare.
Wow.
Yeah, 77%. They talked about being viewed as having a personality issue, a lack of fortitude, feeling being viewed as demanding or distrustful of the medical professional, and feeling like they had to be the one to educate the medical professional on top of managing their chronic illness.
You're like,
in that
yeah,
study.
Sounds relatable.
as someone that just interrupted someone's ski trip, God forbid, right? I think that piece of like educating and then also having to or choosing whether or not you want to educate them on mental health and like mental health challenges and knowing that like the repercussion could be stigma. Not a, like that's a added layer there too, right? And I mean that study is just for that's not like specific to anxiety and OCD, right?
Yeah. I mean, I'm autistic. I love teaching people about autism, but I have to be like, you know what? There's a time and the place. So, when the doctor evaluating me for dysautonomia is like, you don't seem autistic. Why do you think you're autistic? Tell me more. I need to really inhibit my impulse to educate that doctor. This is not time for you to do a YouTube presentation, Stacy, on what autism is in women who don't have intellectual disability, right? This is your time to be like, oh, that's cool. Let's go back to talking about my dysautonomia. Thanks.
Well, you're not getting paid for this. In fact, you're paying him, right? No. Haven't pay you for that training.
Give him a discount code to one of your next trainings.
I generally do them for free. In fact, I'm pretty much always doing them for free.
I think that's right. I think
yeah, he should be charged.
Yeah. What are your recommendations to people, Alie?
So many thoughts. I think just people, I really appreciate also that like there's so, navigating chronic illness, let alone adding OCD anxiety is such a unique experience for every single person. So I think that's where like you and me, Sandy, are talking about like, yeah, since toddlerhood and like being in it your entire life versus having it come up, come out and like suddenly that it's not a one size fits all experience at all. And therefore, like what I recommend to people doesn't, is going to be completely different. I think that I have because of being an OCD therapist that also really specializes also in health anxiety and panic disorder, my crowd tends to be the people that during the intake, I'm like, so when you go compulsively to the ER, which one do you go to? Oh, and then after you go to that one, what are the other local ERs that you go to avoid the experience of being invalidated? Or, oh, you want to keep it outside of that Like, I'm so used to that crowd because that's me too, of like strategically going to hospitals that are not in the same network to avoid being targeted as like a frequent flyer, professional patient. And so
Yeah.
with folks, I think that's where so much of the conversations is exactly what we were just talking about, of like, both can be true, right? That's very DBT-esque, right? Both. Diact.
Yeah.
You can
Dialectic.
you can be sick. You can have a chronic illness. You can have something serious going on and have OC and anxiety. And I think that's where I really pride myself on being like, and I can tell you what I can help with. That's the OCD. Not going to any sort of illusion that I can help with your chronic illness. I've been spending 30 years figuring out my own. Haven't gone very far. And just being honest with people about that while also leaving room for like, this is a thing, right? And I think I've had to do that in my own journey with OCD, and having it unfortunately all around my health content is that my greatest fear was that I was going to be invalidated or gaslit, and then I was going to die as a result of being overlooked in the medical system. And so I've had to navigate being like, yep, these pieces are real, and so is OCD and anxiety, and what can I do, and what's going to be my tendency, right? And so easier said than done. And I think connecting with other people who get it, that then when your doctor is telling you all the reasons why you shouldn't be on your medication, even though you have a specialized perinatal OCD psychiatrist, is helpful too. So
Yeah. And so ending with a message of hope, it's okay to get second opinions. It's okay to get third opinions. Really, really be mindful of the source of the information that you're taking in, right? And that person, whether that is an actual expert in that area that they're giving you information about. I mean, some of my diagnoses, it can be a very, very long time coming. Just as an example, before being diagnosed with celiac, I think I saw 5 different neurologists. And it's not uncommon. It's not uncommon that you may have to be really, really persistent and see multiple people before getting more information. And even if the medical system doesn't have a clear-cut answer for what is going on with you, you can still find symptom relief, and you could still find really supportive, helpful medical professionals. Yeah.
absolutely.
Do you guys have any messages of hope you want to add before you wrap up?
I guess even with chronic illness and OCD or other mental health conditions, there's still so many ways to have a meaningful life, even in the midst of those conditions.
I totally agree. I feel like my like physical life may have like gotten a little smaller with like capabilities and things I can do, but my life has also gotten so much richer through meeting people like you guys and getting to like know others who go through these experiences. I think my life has been just as, if not richer.
Definitely been formative in my practice of medicine. Yeah.
And then you get to meet with people who also can tell you about all the places that they ship their poop to, right?
What's cooler than that?
Joy.
Let's make a chart with the thumbtacks to know where our poop has gone in the world. That's so beautiful to me.
I love it.
Thanks for listening to another episode of Chronically Real and Clinically Relevant. You can find us at stacygreetermd.com and
OCDandanxietycolorado.com, and we encourage y'all to keep it real
and stay curious.